On this episode of Ask the Doc, we've invited Dr. Peter Andolina, one of our plastic surgeons here at King's Daughters, to talk to us a little bit about skin cancer. So Dr. Andolina, what are some of the main causes of skin cancer?
So one of the major causes of skin cancer is exposure to the sun. A lot of people like to do sun tanning and tanning beds. And those really, they give you a nice tan, but they really do expose you to a lot of harmful radiation. Other issues or other predisposing factors would be exposure to radiation, certain pesticides or chemicals, depending on, usually those are occupational exposures. Also, some chronic wounds. Patients that have wounds long-standing can develop cancer that way. And genetic disposition, family history, things along those lines.
Great, those are a few things that I was not aware of.
Mm-hmm.
What are some things that we can do to prevent skin cancer?
The biggest thing to do to prevent skin cancer is number one, to cover up. So sunscreen, really, really important, especially starting in the spring once it starts to get sunny out. And even on like those cloudy days, really sunscreen or a product with sunscreen in it is very important. A lot of moisturizers and skin products now also have some sort of sunscreen built into them, so really look into that and make sure, because if it's part of your daily routine, you might not have to put something else separately on. Covering up, hats if you're going to be outside, long sleeves when you can tolerate them, sunglasses. Really, it's preventative. Obviously, try to limit exposure to, any sort of harmful chemicals or things along those lines.
What type of spots should they be looking for on their skin or be aware of?
So things you want to look for are any sort of spots that, number one, are new to your skin, that have come up recently, things that are kind of growing at a fast rate, things that may have a different color, or changing in color, changing in size, changing in the, usually also look for like asymmetry or irregular borders. So if it's not nice and round, that may be a clue that it may be something. Also wounds or lesions that just don't heal or kind of ulcerate. Those are things to also look out for.
If we see any of these spots on our skin, what should we do?
I think the first thing and the best thing to do is get an appointment with either your primary care doctor to get them looked at, or a dermatologist if you do have one. And that's usually the first step. Don't try to do anything at home. Don't try to ointments, creams. I mean, you can try them and see if that helps to resolve them, but if it's truly a skin cancer, it usually won't do much for them.
Okay, great. Thank you so much for your time today. We really appreciate it.
Very well.
Thank you so much for joining us.